We are part of the solution, one that will benefit all human and planetary health.
It's very hard to be healthy on a land that's screaming out for help. Humanity cannot be well when we're not caring for what looks after us, and that's our planet Earth.
For Indigenous peoples globally, our concepts of health are holistic. Our health is also dependent on the health of our family, our community, and our land. So much so that it cannot be separated.
We kind of lost the connection we had with nature and with different ways to approach health. It's not like you have to choose medicine over natural ways of approaching health.
I think it's important that we redress the balance so that it's not all one thing or the other, but actually that we can find a beautiful middle ground.
Medicine comes from a culture, from a geography, from a place, from a people, from a need, from a climate.
Traditional medicine matter to the people of Africa because this is our culture, this is our future.
I think it's important that we realise that conventional and traditional medicine can go hand in hand.
Today there's more reliance on Western medicine, and what we do need to have a really strong forward-looking, progressive way of being able to recognise the medicines of millennia.
Que no se pierdan esos saberes propios, nuestros, que son tan sagrados, que son tan nuestros, que es la esencia de la vida del ser humano. De estar conectados con la diversidad de pueblos, con la diversidad de nuestras semillas, con la diversidad de nuestras plantas, con la diversidad de nuestras aves.
Yoga is basically an ancient Indian practice. Yoga brings out the positivity from within, it improves our mental well-being, and it brings out the overall well-being of an individual.
TCIH is about more than just medicines. We need research on professions and practices more than just products.
We, as Indigenous peoples, know that our intimate and intricate understandings of our lands and our medicines have so much to offer everyone.
It's now time to recognise the opportunity that we have. It's time to turn on our ears, open our eyes, open our hearts, and understand where we need to go to together, collectively.
Traditional medicine matter to the people of Africa because this is our culture, this is our future. And for millennium, traditional medicine was used by our ancestors. Traditional medicine holds great potential, can play a pivotal role in advancing global health and well-being. Examples of traditional medicines from the African region include medicines for use for the treatment of communicable diseases such as HIV-related, and those for non-communicable diseases such as diabetes, hypertension, sickle cell disease. Even if medicines are derived from traditional practices and deemed to be natural, establishing their efficacy and safety through rigorous clinical trials is critical to guarantee that treatment is effective and safe. The practitioners are delivering safe services and quality services. It is important to integrate traditional medicine into health systems because of the benefits that this integration will bring about.
I remember feeling really afraid 2 years ago when I was gasping for breath, feeling like, I didn't know what was happening to my body and I was no longer in control. I consulted lots of allopaths, the family doctors, specialists, they ran a whole bunch of tests. They said that I was allergic, probably to dust, but that it couldn't be fixed. And so I decided to consult a homeopath. He told me to start yoga. I had to incorporate exercises for my lungs within everyday regular activities. I have young kids, so he said, blow balloons every day. That will help strengthen your lungs. And with homeopathy, it's mind plus body. So you're playing a more active role. You're observing, you're making changes, you're reporting back, you're checking in. And particularly pranayam in yoga. And to make sure that it's something I did every day, not just to strengthen my lungs, but also to de-stress. This entire journey with traditional medicine has made me realize that there is a very strong connection between our mind and body. You have a role to play in your own health. You can make choices that impact how your body reacts or responds or heals. A lot of it is in your hands, and I love that.
The most stressful part of what I do as an athlete is that first round jump when I'm at the top of the runway. Being based in the UK, being born and bred in Manchester, I have certainly been brought up with a very conventional mindset around medicine and healthcare. I'd literally had 2 years of incessant injury, 2 surgeries within the space of basically 12 months. And I'd had enough. I really wanted to seek out healing, and that healing wasn't just a physical healing, it definitely was an emotional, spiritual, mental healing. Some of the important practices that I do personally to focus on staying healthy would be making sure that I go out and do my meditative walks in the woods or in the forest, even in the park nearby to my home. I think it's important that we realise that conventional and traditional medicine can go hand in hand. You can't keep giving, going hard 100% of the time, because ultimately you're going to burn out. I have this rhythm of rest, recovery, performance, rest, recover, performance that is part of my day, my week, my month, my year.
What has been for centuries the integral source of health for people and communities? What is still the first port of call for millions of people?
while somebody's speaking. Ladies and gentlemen, we're just waiting for more people to join us, and we are ready to start the valedictory. So we've sent out our wonderful volunteers to herd more people inside the hall. While you're seated, may I request you to please keep your mobile phones in the silent mode so that it doesn't go off in between while somebody's speaking. And I think maybe you could give yourselves a cheer. You've had 2 intense days of a lot of work that has happened. So could I request you all to please put your hands together and give yourselves an applause. Nina. Across the world, the WHO Global Summit on Traditional Medicine was a platform for all our stakeholders, including traditional medicine workers, users, and communities, global policymakers, international organizations, academics, the private sector, civil society organizations, and indigenous peoples' representatives to share best practices and game-changing evidence, data, and innovation on the contribution of traditional medicine to health and sustainable development. We are now at the close of the first WHO Global Summit on Traditional Medicine and are really beyond happy, actually, to have helped contribute to enhancing the lives of billions of people and making the planet better. It is time now to reflect on the continuous engagement and the high quality of discussions that went on yesterday and today. And we are pleased to acknowledge that a lot of ground was covered across the various themes over the last 2 days. The agenda of the dialogue is deepening, and the world is only going to get enriched. We'd like to share with you a very short excerpt from the Honorable Prime Minister of India's address that took place just a few minutes ago. And we'd like you to just focus on his words. So if we could have the video play.
The establishment of WHO Global Center for Traditional Medicine in Jamnagar, Gujarat, is an important step in this direction. And the holding of
Everything is telescoping to this final session now. So
the establishment of WHO Global Center for Traditional Medicine in Jamnagar, Gujarat, is an important step in this direction. And The holding of WHO Global Summit on Traditional Medicine along with G20 Health Ministers meeting will intensify efforts to harness its potential. It should be our joint effort to build a global repository for traditional medicine.
Minister of India and his wise words and visionary leadership. We'd like to now request Dr. Hans Kluge, the WHO Regional Director for Europe, to please say a few words.
Our gracious host, the Ayush and Health Ministers of India and the Government of Gujarat State, Secretary Vaidya, Ambassador of India to Geneva, friends and delegates from all corners of the world. Quoting Mahatma Gandhi, the father of modern India, a man whose words continue to inspire. Namra tariki se ab dunya ko khila sakti hai. In a gentle way, you can shake the world. Well, my friends, after just 2 days here in Gandhinagar, the city named after the Mahatma, I think it's no exaggeration to say that all of us together have gently shaken up the status quo that has, for far too long, separated different approaches to medicine and health. By taking aim at silos, we are saying we will collaborate all the more to find optimal ways to bring traditional, complementary and integrative medicine well under the umbrella of primary healthcare and universal health coverage. Collaborations underpinned by science and evidence and safety. Collaborations that acknowledge the very real role TCI medicine plays in the lives, health and well-being of people globally. Health and well-being achieved through the principles of equity, affordability, and quality. In these 2 days, we have explored innovative models that combine modern medicine with various forms of traditional, complementary, and integrative medicine. Models that stand up to the rigors of scientific study and research. We have called for policies that promote standardized traditional medicine documentation and accelerate the use of International Classification of Diseases, or ICD-11, thus enabling seamless integration and evidence data generation within routine health information systems. We have reiterated how crucial it is to get better evidence on the effectiveness, safety, and quality of traditional and complementary medicine. That means innovative methodologies for assessing and evaluating outcomes. Controlled clinical trials may not always be feasible here. But by the same token, the same goes for many interventions in modern medicine and healing. For example, psychotherapy and certain forms of surgery. But what we do need is better data collection, getting the basics in place to be able to better benefit from traditional and complementary medicine. In a session this morning, a traditional medicine practitioner from the African continent sitting in the audience appealed for just this, for better data. She acknowledged that when the data are not there, it becomes far more challenging for traditional medicine therapies and modalities to be taken seriously by the wider medical fraternity. We also discussed how digital health and artificial intelligence applications can be at the service of traditional medicine. In this, I stressed that while this technology is a game changer for health as a whole, Digital health transformation means using better data to better inform policy decisions. And not least to ensure technology does not leave already vulnerable populations behind all the more. Equity must guide us in all that we adopt and implement. Then the sometimes contentious issue of regulation of professionals, practices and products. Regulation not to pit modern medicine against traditional medicine, but to truly benefit from all modalities by avoiding harms, addressing safety concerns and not least unnecessary spending of money. Remember access and affordability and Hippocrates, primum non nocere. First of all, do not harm. Finally, something that personally struck me through all the discussions I've heard, the need to respect one another, respect tradition, respect local culture, professionalism and practices. Yesterday, another delegate from Africa, a healer, made an impassioned plea to WHO to advocate with governments and ministries to take traditional medicine seriously by affording genuine practitioners the respect they so deserve. In so doing, this gentleman acknowledged what an important role WHO plays in charting the global health agenda, a responsibility all of us at WHO take very seriously. And what an opportunity with the International Conference on Primary Healthcare 22-23 October in Astana, Kazakhstan, to which all of you once again are invited to further integrate TCI medicine in modern primary healthcare. Another Mahatma Gandhi quote I appreciate so much, one both simple yet profound, says, Ap ajokarte hei obser bhavisha nirabhar karta hai. The future depends on what we do today. I came here from the WHO European region 2 days ago, primarily to listen and learn in modesty. I have listened carefully, and it's amazing how much I learned. My pledge today is to take all that I have absorbed to heart, to find ways to forge stronger bridges between our various disciplines, all with the aim of bringing about better health outcomes, not only for the almost 1 billion people in the 53 countries of my region, but for the entire world. Dhanyavad. Thank you.
Thank you, Dr. Hans Kluge. Ladies and gentlemen, to improve the golden moment of opportunity and catch the good that is in our reach is the great art of life. As many of you know, the WHO had appointed 11 experts in health and well-being and traditional complementary and integrative medicine, public health and policy to its external advisory group to provide strategic and technical advice to this summit. And we would like to now invite the co-chairs of this advisory group, Professor Bhushan Patwardhan, who is the National Research Professor, Ayush, at the Interdisciplinary School of Health and Science, Savitribai Phule University, Pune, and Dr. Susan Wayland, the head of Cochrane Complementary Medicine File based in the University of Maryland School of Medicine. So both of them will share their reflections and takeaway messages from the multi-stakeholders.
Thank you. On behalf of the external advisory group constituted by the World Health Organization for the purpose of this summit, both me and my co-chair, Dr. Suzanne, are very happy to share some of our reflections. And thank you, Shama, for this opportunity. If I want to really capture the whole thing in essence, I remember what Sione, my colleague, started while moderating, Vasudhaiva Kutumbakam, one world, one family, one future. That's the echo I could hear from all over. And it is extending further now when we were in the G20 summit, one planet, one health. That was the message which was coming in. And we thought we discussed here from one health to one health system, because one health is no more restricted only to zoonosis or to animals and planet relationships, but it is much more. So we are moving into the planetary health. And based on this theme, the whole group, along with some of the top editors in the world, we wrote a special editorial which was published in a journal. And today, count is 14 international journals have published it together, And thank you. And so I'm not going to really explain more about what our thoughts are, but this editorial really captures the discussions and vision very well. The evidence-based traditional medicine and planetary health and well-being was also covered in yesterday Lancet, and today it was also recognized in the special news item by Nature. Why I mentioned this is international media and scientific community is also looking at us very, very curiously. And therefore the responsibility on us is even more now. And the science base of it is going to be extremely important. And for that, I think no better person than Dr. Susan, who is here. Before I close, I would again repeat the sentence which I talked in the plenary session. Traditional medicine plus conventional medicine is tomorrow's modern medicine.